Hi everyone, we're going to look at the microvascular complications of diabetes. We're going to check what is diabetes, which will help you understand how it affects the body. We will then look at the main microvascular complications, which are diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy, especially the peripheral neuropathy. References are listed on the last slide, so let's get started. Microvascular complications of diabetes are health issues caused by damage to the small blood vessels due to prolonged high glucose levels. We call this term hyperglycemia. These complications are common in individuals if blood sugar level is not well controlled. Chronic high blood glucose level leads to damage to the blood vessels, small blood vessels. This damage causes inflammation, narrowing of the blood vessels, and reduced oxygen delivery due to tissues. Over the time, it impairs the functions of organs like kidneys and nerves. Now, let's look at what is diabetes. Diabetes is a chronic health condition that occurs when the body cannot effectively regulate blood glucose levels. Glucose is an essential energy source for the body's blood cells, but its regulation depends on the hormone called insulin, which is produced by the pancreas. Diabetes disrupts this process, leading to persistently high glucose levels that can damage the body over the time. I'm going to mention the very common types of diabetes: type 1, type 2, and gestational diabetes, which is the pregnancy diabetes. Now let's look at how diabetes affects the body. When blood glucose levels are consistently high, it can lead to damage in various parts of the body, including your blood vessels, circulatory system, nervous system, kidneys, eyes, immune system, skin, and also mental health. Now let's look at the main microvascular complications. The first one is diabetic retinopathy, which is called the eye disease. High glucose level damage the tiny blood vessels in the retina, causing them to swell, leak, or close off. New abnormal blood vessels may grow, which are fragile and prone to bleeding. Symptoms can be blurry vision, patchy vision, floaters or spots in the vision, complete vision loss or blindness, and retinal swelling or abnormal blood vessels during the eye examination. How to prevent this? You need to go for annual retinal screening, maintain good glucose levels, blood pressure, and cholesterol. Treatment options may include laser therapy or injections in the eye, and surgery for advanced cases. Now, let's look at what is diabetic nephropathy, the kidney disease. Damage to the tiny filtering units in the kidney is called glomeruli, responsible for filtering waste from the blood. Over the time, this leads to scarring and reduced ability to filter waste effectively. It can lead to protein leak in the urine, called albuminuria, or decreased kidney function, or even kidney failure. Some of the consequences are waste building up in the blood, leading to the symptoms like swelling, fatigue, and feeling nauseous. End-stage kidney disease may require dialysis or even a kidney transplant. Let's look at how to prevent this diabetic nephropathy. Monitor your kidney function regularly, especially the urine and blood. Maintain good glycemic level, blood pressure, and avoid medications like nephrotoxic drugs. Limit salt and protein intake in the diet. Also use medications like SGLT2, ACE inhibitors, ARBs. Lastly, let's look at what is diabetic neuropathy, especially the peripheral neuropathy. Damage to the small blood vessels that supply nerves, especially in the extremities. Nerves become damaged, leading to improper signal transmission. Let's look at the symptoms of peripheral neuropathy. People often feel tingling, numbness, or burning sensation in the feet and hands, loss of sensation, loss of sensation in the feet, increasing the risk of injuries and infections, or even causing ulcers leading to amputations. Like I said, the consequences can be foot ulcers, may form due to unnoticed injuries. Severe cases can lead to amputations due to infected or untreated wounds. Let's look at how to prevent peripheral neuropathy. Inspect your feet daily for discoloration, wounds, cuts, or sores or infections. Wear comfortable, well-fitted shoes. Maintain good blood glucose levels to prevent further nerve damage. Make sure you go for diabetes annual screening, especially the feet check. If you got peripheral neuropathy, I would like to give you some advice. Please make sure you check your feet daily, making sure the skin is not sore or broken. Wear well-fitting shoes that do not rub anywhere or pinch your toes. Cut your toenails straight across and file any rough edges. If you smoke, you should try and stop, as smoking increases the risk of poor circulation, especially to the feet. Use a moisturizer on dry skin and keep your feet clean by washing and drying daily. Lastly, let's look at the general strategies for prevention and the management of microvascular complications. Make sure your diabetes is well controlled. Aim for target HbA1c level recommended by your doctor or your diabetes specialist team. Control your blood pressure and cholesterol level. High levels worsen microvascular damage. Use medications like ACE inhibitors, ARBs, or statin may be prescribed if your cholesterol is high. Maintain healthy lifestyle, balanced diet, exercise regularly, and avoid smoking. Make sure you go for regular checkups, as early detection of complications allows for timely intervention. Thank you for listening. I hope you enjoyed the session.